بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Dear students, again this is Ahmed Abdel Libiari, Professor of Clinical Toxicology. Today inshallah we will go through the section of the general toxicology. We will talk about treatment of poisoning. We will select just two elements of the four major lines for treatment. Just to remind you, this is the patient, this is the toxin entering into the body, producing actions that may appear in the form of manifestations, and the body is trying to get rid of the toxin through elimination routes, the usual elimination routes. How to interfere with this? First, you may try to prevent absorption, which is called decontamination. Try to prevent the toxin from entering the body. Or you may administer an antidote, a drug that may antagonize the action of the toxin. Or try to enhance the elimination system, try to increase the excretion of the drugs or the toxins from the body. And you may also treat manifestations. Any symptom that may appear, you can treat it through the symptomatic or the supportive treatment. Today, inshallah, we will talk about the use of specific drugs and antidotes and the emergency and supportive care. Starting with the specific antidotes. Some antidotes may act through modifying the kinetics of the toxin. For example, we may use oxygen in case of carbon monoxide poisoning. Oxygen competes with carbon monoxide and increases its elimination. We may also use N-acetylcysteine in case of acetaminophen poisoning or paracetamol poisoning. N-acetylcysteine is a very important antidote. It eliminates or increases the elimination of the toxic metabolites of acetaminophen. Other antidotes act through interference with actions. For example, naloxone is a very important antidote for opiate toxicity. Naloxone acts through competition with opiates at opiate receptors. Opidoxime and other oximes can be used for treatment of organophosphate toxicity. Oximes compete with organophosphates at the cholinesterase enzyme. Deferoxamine is the antidote of iron. It can eliminate iron. It can help elimination of iron from the body. But first, it acts with iron by binding through chemical bonds, preventing iron from exerting its actions and enhancing its elimination also in a non-toxic form. Digoxin-specific antibodies are the antidotes for different forms of digitalis, digoxin and digitoxin. They combine with them through immunological binding. These are few examples of some antidotes. It's very important to select the antidote based on the clinical manifestations, based on the diagnosis of the case, and also the condition of the case. Antidotes are used specifically in certain conditions, not in all conditions. As you select the antidote based on the indications or specific indications, you may also consider contraindications. It's important to recognize any condition that may interfere with the use of the antidote. What about the emergency and supportive treatment? We will discuss several items regarding the airway, breathing, circulation, convulsions, coma, hypo and hyperthermia, and rhabdomyolysis. Each item is discussed in 2 points: assessment and treatment. First, you have to assess the condition of the patient and recognize the problem. The causes of the problem and the complications also are very important to be identified. Then you have to treat the person. Of course, you will treat the condition and the causes and complications. But as you are dealing with a human being, at any point of time, an emergency appear, you should resort to treatment of that emergency first. Starting with the airway. Assessment of airway and causes of airway obstruction. You have several causes that may obstruct the airway. Common causes include the presence of foreign body or falling back of the tongue, which may obstruct the airway in a comatose person when he is lying on his back. Secretions or vomit, for example, persons with organophosphate poisoning. Swelling or edema, for example, patients exposed to irritant inhalational toxins like chlorine, for example. This is the picture of the airway. This is a clear patent airway. If this person is comatose and he is lying on his back, as this picture, by its weight, the tongue may fall backwards and obstructs the airway. To deal with airway problems, you have first to keep the airway patent and clear. This is one maneuver. It's called head tilt, chin left, aiming at maintaining the airway straight, patent, and clear. You may also use airway devices like oropharyngeal airway. This device is called oropharyngeal. There is another one which is inserted through the nose. It's called nasopharyngeal airway. Sometimes, to deal with airway obstruction effectively, you may use a tube like this, inserted into the trachea. It's called endotracheal tube. And the process is called the endotracheal intubation. But if the airway is already obstructed, for example, a patient with laryngeal edema, you may not be able to insert an endotracheal tube. At this point, you may use tracheostomy tube. These videos are very important to clarify these ideas. I recommend them. What about breathing? To assess the causing of breathing problem, you may think of drugs and toxins that may inhibit the respiratory center in the CNS, or causes, for example, sedative hypnotic drugs, overdose from sedative hypnotics like barbiturates, or causes that may obstruct the airway passages, for example, toxins that may increase the bronchial secretions, like organophosphates and carbamates, or those toxins affecting the lung. Sometimes acute pulmonary edema may be a fatal condition resulting from some toxins, like inhalational irritant drugs, irritant toxins, or chemicals. Also, toxins affecting the respiratory muscles, which may occur in some cases, like some types of snake poisoning, some types of bacterial affection like botulism. All these causes may affect breathing. And to deal with breathing problem, first you have to deal with the condition, the problem itself, and of course you have to search for the causes and the complications and treat them also. At any point of time an emergency should appear, you have to deal with first. What is emergency regarding the breathing? Airway problems may be more urgent to deal with. Any person with breathing problem may need assisted ventilation, either manual like this or through the mechanical ventilator like this. Deal with any problem like bronchospasm using, for example, a selective beta-2 agonist to dilate the bronchi, or treat pneumonia and pulmonary edema as usual. Search for the causes and the complications and deal with them. These videos are very important to clarify the idea of how to deal with breathing problems and how to perform CPR in a proper way. Dealing with the circulatory problems, first check the pulse and the blood pressure. You may cannulate the patient. Insertion of a cannula may be important to withdraw a blood sample and to be able to inject drugs and large amounts of fluids. Also, cardiac and blood pressure monitoring, continuous monitoring in emergency cases. Catheterization of the urinary bladder is also essential in critical cases, just to keep them in bed and be able to withdraw a urine sample for drug analysis, for example, drugs of abuse, and also collect urine to be able to calculate the fluid intake and the fluid loss and keep the balance. Dealing with the shocked patient requires to look for any emergency first regarding any airway or breathing problem and deal with the shock itself. Elevation of the legs of the patient may increase the venous return and enhance the cardiac output a little. Warmth, especially in cold weather. Intake of fluids is very important, and it is the initial step in treatment of any shock. You may give crystalloids or colloids. Sometimes administration of drugs may be needed. You may use sometimes vasopressors or corticosteroids. Search for the causes and the complications and deal with them. Seizures may occur due to overdose from CNS stimulants or poisoning from CNS stimulants like cocaine and amphetamines. Sometimes from withdrawal from sedative hypnotic drugs, especially if the person is addict to these drugs. The use of some antidepressants like tricyclic antidepressants or the use of antipsychotics like phenothiazines, overdose from these drugs may result in convulsions or seizures. As usual, deal with any emergency first and deal with the condition itself. Diazepam is one of the preferred drugs for treatment of seizures. Is safe and effective. However, if you use multiple doses from diazepam and it is not effective, you may try to use phenobarbital or phenobarbital. It is one of the long-acting barbiturates. If it is also ineffective, you may use phenytoin. Finally, if all these measures are not effective, you have to administer a skeletal muscle relaxant to cause paralysis of the skeletal muscles and general anesthesia of the patient. But in this case, complete paralysis of the muscles will include the respiratory muscles, and the person should be put on the mechanical ventilator. Search for the causes and the complications and treat them. A person in coma may be due to exposure to toxic substances like overdose from CNS depressants such as benzodiazepines or barbiturates or alcohols. Sometimes the coma may be due to metabolic or traumatic causes, for example, head trauma. This is the Glasgow Coma Scale. The person is scored according to three elements: eye opening, the verbal response, and the motor response. A fully conscious patient will get a score of 15, but a dead person gets a score of 1 plus 1 plus 1. No response at all. So the dead person gets a score of 3, not a 0. Using Glasgow Coma Scale for prognostic purposes is not so good in toxicology, because in acute poisoning, usually the patient regains consciousness when the drug is eliminated from the body or with administration of selective antidotes. So using the Glasgow Coma Scale for prognostic purposes in these cases will not be accurate. Here in acute toxicology, you have no organic lesion, and the development of the case in a positive way may occur rapidly. To treat a comatose person or deal with a comatose person, first you have to recognize if there is any emergency regarding the airway, breathing, or circulation. Then you may administer a group of drugs. These are dextrose or glucose, oxygen, naloxone, and thiamine. These drugs are beneficial. If the person is hypoglycemic, and this is a hypoglycemic coma, dextrose would be the optimum treatment. The person is usually hypoxic, so oxygen would be beneficial. If the coma is resulting from an overdose from a narcotic analgesic, naloxone is the specific antidote. And thiamine is very beneficial if the patient is taking alcohol. These drugs would be beneficial in any case of coma. At least they are not dangerous and nearly without side effects. Deal with the causes and the complications. Complications may arise if the person is comatose for a long period. So you have to deal with the skin, avoid bed sores. The patient his position needs to be changed every now and then to avoid the bed sores. Care for the eye through antibiotic ointments or closure to protect the cornea from corneal ulcerations or infection. The use of suction to avoid accumulation of respiratory secretions to avoid lung infection. And you also have to care for the nutrition and the excreta. A comatose person needs to be catheterized, urinary catheter, and you have to do enema for him. Person in severe hypothermia with temperature below 32 degrees centigrade may appear dead. Don't declare death except after careful examination. To deal with hypothermia, as usual, deal with any emergency first, then deal with the condition. Warming should be slow, using blankets, sometimes warm intravenous fluids, or warm irrigation of the stomach and the urinary bladder with warm saline. Hyperthermia may occur due to a multitude of causes. These are three important causes in toxicology: neuroleptic malignant syndrome, which may occur from the use of antipsychotics, and malignant hyperthermia may occur in some persons with idiosyncrasy to some inhalational anesthetics like halothane, and serotonin syndrome, which may occur due to the use of serotonin enhancing drugs or selective serotonin reuptake inhibitors, plus the use of monoamine oxidase inhibitors at the same time. A patient in hyperthermia need to be cooled rapidly. Rapid cooling by every way. During the cooling process, the patient may get shivering, and you have to control shivering to avoid generation of heat from the muscle action. Use skeletal muscle relaxants, small doses of diazepam, for example. Sometimes you may use skeletal muscle relaxant like Correa, strong skeletal muscle relaxants. They may cause paralysis of the muscles. Sometimes specific drugs may be needed, like in cases of neuroleptic malignant syndrome, bromocriptine is the specific drug needed in these conditions. Search for the causes and complications as usual. Rhabdomyolysis. It slices or damage of the skeletal muscles. It may occur due to prolonged immobilization on hard surfaces, like a patient in deep coma for a long period. The occurrence of seizures and hyperthermia, or in case of carbon monoxide poisoning, these may cause damage of the skeletal muscle. Elimination of the skeletal muscle. Damage of the skeletal muscle may be associated with release of myoglobin into the circulation. It may obstruct the renal tubules and end in renal failure. Of course, these conditions are usually associated with elevation of the serum creatinine phosphokinase. To treat rhabdomyolysis, you have to give excessive amounts of fluids and strong diuretics to help elimination of myoglobin from the renal tubules. And the use of alkalinizing agents like sodium bicarbonate may help or may reduce the precipitation of myoglobin in the renal tubules. However, if renal failure occurs, you may need to perform hemodialysis. Search for the causes and complications as usual. To summarize this lecture, we have discussed the treatment using specific antidotes. They were classified according to the mechanism of action, and always search for specific indications of these drugs, and also if there is any contraindication for their use. Emergency and supportive care regarding the airway, breathing, circulation, convulsions, coma, hypothermia and hyperthermia, and rhabdomyolysis. You have to assess the patient, then deal with the condition. These were the main topics today. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.